Hi, how are you today?
Good, how are you?
Doing good. My name is Lorraine. I am the substance abuse counselor here, and we're going to go ahead and just do a quick assessment to get to know you more, gauge where you are, and how we can move forward in supporting you. So I'm just going to ask you a few questions, and we will get started. Can I have your first and last name, please?
Rachel Green?
Rachel Green. Do you have a middle name, Rachel?
No.
Okay. And your age, sex, and race, please.
I am 24 years old. I'm a female, and I am Filipino and Mexican.
Okay. Ethnic background?
Mexican?
Mexican? Okay. And are you currently employed?
On and off.
On and off? Okay. And what is your on and off position right now?
I do Uber Eats.
Uber Eats, okay. And your marital status?
I'm single.
Single. What is your current living situation?
I live with my parents.
Okay. And the presenting problem today, why you're here for Bright Road Recovery, is for substance use?
Yes.
Okay. And what is the substance that you are taking?
Alcohol.
Okay. Roughly how much do you drink per day, per week, per month?
I drink about 6 to 7 a day.
6 to 7
Drinks a day.
Drinks a day. Is that liquor? Is that beer?
Anything.
Anything? Okay. All right, I'm going to ask you a few questions about your family background, including intergenerational themes, family dynamics, and cultural assessment. So this is basically just asking, does alcoholism, addiction run in your family?
Well, my dad, he is sometimes present, sometimes not. And my mom, she is an alcoholic.
Okay. Is she in recovery? Is she currently using?
No, she's functioning.
Functioning alcoholic. Okay. And did you grow up with her? Did you grow up with another family member?
I grew up with my grandma and just moved in with my parents.
And you're living with your mom?
Yes.
Okay. And you've been in her house now, mom's house?
For 4 years.
4 years, okay. So since you were 20?
Yes.
Okay. For the risk assessment, are you having any thoughts of suicide, homicide? Have you been abused as a child, domestic violence, substance abuse? Substance abuse is something that you stated. Do any apply?
Mental health.
Mental health,
I
okay.
had a lot of mood swings, so it causes depression.
And mood swings can come from withdrawals. Have you been going through withdrawals lately?
I try. Whenever I feel the urge to drink, I'll try to drink coffee or soda.
Okay. What is the longest withdrawal that you've experienced? How many days have you gone without drinking that you start to feel like you need another?
Probably half a day.
Half a day? Okay. All right, and medical history. Medical history as far as, so you did mention that alcoholism does run in your family, so predisposed to substance abuse.
Also diabetes from the alcohol.
Diabetes, okay. You also mentioned that you have mental health concerns. Do mental health needs run in your family or concerns?
My mom, she fell into depression as well when her and my dad split.
Okay. Anything else that we need to know? Any past doctor's visits, hospital visits?
Sometimes
Okay.
liver issues.
Okay. Have you, when's the last time you went to the doctor?
Maybe a year ago.
Okay. And one thing that we do, that we will support you here is that once we are done with the assessment, and you are checked in, we do take you to the doctor to get a full scan, just where you're at, your blood levels, so then we can gauge where we can support you in just your medical needs and dental needs as well. Okay, any relevant medical and developmental history? Anything that I need to know of? Any hospital stays, surgeries?
No.
Okay. Current stressors. What is stressing you out at home, at work, at school, within your life that is prompting you to drink?
Because of the alcohol addiction, I had to drop out of school because it was just becoming too much.
Okay.
I failed all of my classes because I couldn't keep up. I also had to quit my job and do delivery because I couldn't function at work either.
Okay. Is home a stressor?
Yes, it can be with my mom. She also does not know that I dropped out or that I got fired.
Okay. All right. Relationships, family, friends, coworkers. Are there family members that are supportive, not supportive, friends, relationships, anything that is a factor when it comes to substance abuse?
No, my relationship ended because of the alcohol abuse, and I don't have any family members that are close to me to help me, and all my friends left as well.
All right. What are some strengths that you have? What are some strengths that you have? It could be you are good at communication, you're kind, you're honest, what are some strengths that you know and see that you have?
When I'm not drinking, I know that I can be very hardworking and determined.
What was the position that you were working in before Uber Eats?
I was a preschool teacher's assistant.
Okay. I'm sure there's a lot of patience in that too, working with children. Patient.
Yes.
Kind. Okay. Anything else you want to add?
No, that's it.
All right. And any current barriers, risks affecting the problem? So anything that you are seeing that is affecting drinking or stop drinking, sobriety?
Yeah, I think when it comes to delivery, whenever I get paid, instead of having to go home, I just go straight to a bar since they're nearby, and since I'm already driving, I just find different bars everywhere to drink.
Okay. So maybe money management. Okay. So paycheck, money. Anything else?
No, that's it.
Okay. Any barriers as far as with your mom, home life, any risk affecting?
Well, just with my mom drinking all the time at home as well.
Okay. Is that a trigger for you when she's drinking?
Absolutely.
And when she's drinking, do you guys argue, ignore each other, get along? What's that relationship like?
She normally just yells at me and I just go to my room.
Okay. Okay, anything else that you would like to add or that I should know about to support you?
Not that I can think of.
Okay, all right. Thank you so much, Rachel.
Thank you.